What is HSG? HSG stands for hysterosalpingography. It is a diagnostic modality in which a liquid-based dye is injected into the cervical os of the female after dilating it, and then the anatomy of the uterus and the fallopian tube is studied by taking serial X-rays. Remember that it might cause a certain amount of discomfort, although not too painful, but cramping sensation may be present during or after the procedure, which can very well settle within a day or two with mild analgesic or bed rest. So what are its indication, contraindication? Let's try to find out. So as I already said, it is to study the uterine cavity and the fallopian tube. It is usually done in the post-menstrual phase and before the ovulation. So between day 5 to day 9 is generally what we advise. In MCQ, if you have to mark a single best, then day 10 is the right answer. What are the indications of HSG? Remember, first is to study the patency of the fallopian tube in case of infertility. Next is to study any structural anomalies in the uterus. It can be even a polyp, which may be causing menorrhagia or irregular bleeding, or it can be a fibroid, usually the submucosal fibroid. Then in case of any uterine anomalies like biconvate or septate, used to study the tubal patency after a tuboplasty surgery. What are the contraindications? Remember, any active genital infection is a strict contraindication to HSG because HSG is an invasive procedure. It will lead to spread of the infection. So if the patient is allergic to dye, then do not perform it. And also do not perform it in the post-ovulatory phase as the patient might be pregnant. Remember that HSG is strictly contraindicated in genital tuberculosis patient, because it will not just cause spread of the infection, it may also lead to reactivation of the infection. But in case by mistake you have performed unknowingly HSG in case of a genital TB patient, then what are the important signs that you will see? Now these will be given in the clinical case-based scenario in the MCQ. So one will be lead pipe appearance of the tube, beaded appearance, hydrosalpinx, cornual block, in golf club tube, tobacco pouch appearance. Asherman syndrome, which causes usually secondary amenorrhea. In that also you will find you can do a HSG, and there you will find honeycomb appearance or filling defect.